So this is a very interesting MRI image. This particular image is called venogram. So this particular image is called venogram, and it is basically mainly to see the brain's venous system. So venous system we need to see only if we suspect venous sinus thrombosis. This is one of the most common disease where we need to see any disease. So what we see, we must know basically the most important veins, which is superior sagittal sinus. So this is superior sagittal sinus. If you can see, this is in the middle of the brain, and this is the largest vein of the brain, and it is called superior sagittal. It is superior because it is present at superior aspect, sagittal because it is present in middle of the brain. It is in the middle of the brain. And then this superior sagittal sinus is accompanied by bilateral transverse veins. So this is the transverse vein, and as we know, this is always left side, this is always right side. So in here, what we can see the right side vein very well, but we are not able to see left side transverse vein. So this is transverse vein. So this is transverse sinus, but here on the left side, the transverse sinus is not visible. The second vein is, this is the sigmoid sinus. Sigmoid means S-shaped. So we can simply see that it is present on the right side. You can see this sigmoid sinus, but it is not there on the left side. So not only the transverse sinus is not visible on the left side, but the sigmoid sinus is also not visible on the left side. And the next vein is, this is the internal jugular vein. So here also we are not able to see any internal jugular vein. So this internal jugular vein then joins the external jugular vein, and then it forms the brachiocephalic vein, and both sided brachiocephalic veins, then they again join and form superior vena cava after joining with the subclavian vein, obviously. So in here we are not able to see the left-sided transverse vein or transverse sinus, then sigmoid sinus, and then internal jugular vein. So this is a venous sinus thrombosis of transverse, sigmoid, and the internal jugular vein, which definitely causes then venergic infarct. And the most common presentation of VST is the two most important symptoms, that is, one is convulsion and second is headache. Almost all the patients usually always have these symptoms, that is headache and the convulsion. And most of the time after convulsion, the patient presents with altered mental status. So this is all for today. Thank you for listening.